lectures. And before we get started, I just want to take a moment to thank all of my supporters and everyone for supporting my channel. And don't forget to mark your calendar for June the 24th at 6:30 p.m. Eastern Standard Time. I'm going to do another relational live stream lecture. I'm going to give insight on many things I have done to grow my YouTube channel. So that's one lecture you do not want to miss. So mark your calendar for that date. And I've been marketing that lecture. By the time I do the lecture, I will have marketed that lecture for over a month. Marketing is real important. So with that being said, let's get on down to today's lecture, which is improving your health. Improving your health is a positive way to save money. It will save you money when you improve your health. And when I say health, I'm talking about your spiritual health, your mental health, and most importantly, your physical health. Physical health means going to your doctor's appointments, making sure you get your annual physicals, making sure you're paying attention to your lab work, making sure you're going to the dentist, making sure you're going to the ophthalmologist. Even if you don't wear glasses, you still should get your eyes checked at least once a year. All of these things ties into wellness and health. But I want to put a lot of emphasis on this physical health because I'm going to tell you something. I have a niece that's a nurse, been in nursing for years. And I talk to a lot of people. What's becoming so popular, unfortunately, is many young people now, because they are not taking care of their health. And my niece was telling me this, who's a nurse. Many young people in their 30s and early 40s, because of their poor health, are literally, diabetes out of control, or heart disease, diabetes, to the point where it's causing them to go blind, in nursing homes in the 30s, people. This is real talk. In nursing homes, people in their 30s and early 40s, because of their bad medical health is so poor to the point they are now in nursing homes and filling up these nursing homes. I have many people in my family who's in the medical profession, and I've seen it myself. Young people, morbidly obese. And when you see obesity, that opens up the floodgates for many, a host of health problems, diabetes, heart problems, cholesterol, a limited mobility. Now they can barely even be able to walk. People in their 20s, their 30s, it's out of control. It's out of control. They're not even making it to their 40s. Their health is so poor to the point they can't even move around. They can't even walk without giving out a breath. They can't even walk upstairs. They can't even walk downstairs. It's out of control. Pay attention to, even when you go to the grocery store, you're seeing more and more younger people in these mobile carts, morbidly obese. And you can look at many of them, tell they're young, because sometimes their young child will be falling behind them. No, you can look at a person and tell that they ain't no 70, 60, or 50, or 40 years old. These folks in their 20s and 30s, morbidly obese. And it's out of control in this country. I've traveled abroad. I've traveled abroad to other countries, and you don't see this type of poor health at this level, not in terms of young people with limited mobility, diabetes, morbid obesity. It's out of control, people. You can just take a look at people in your neighborhood. Start paying attention to who are the people who are riding around in these mobile carts in these grocery stores. These are not old senior citizens. No, these are young people. And I'm telling you, when your health is poor, that would have a direct impact on your livelihood. That will have a direct impact on your finances, because now, you ain't able to work. You're going to all of these doctor's appointments, these specialists to treat you. You're on a truckload of medication. I don't care what kind of insurance you have. I don't care if you got state Medicaid or private insurance. Money coming up out of your pocket to cover some of these expenses. Money coming up out of your pocket to cover these co-pays, people. I mean, I seen people in their 20s and 30s on a list of medications for everything from A to Z, with the type of illnesses that will be typically associated with people in their 70s or 80s or 60s who don't live the long life. But no, I'm talking about people in their 20s and 30s with all these type of illnesses that a list of them, heart problems, diabetes, high cholesterol, obesity, breathing problems, on those breathing machines at a young age. They can't even walk to the point without getting out of breath. And I'm telling you, all of this poor health will have a negative impact on your life, your livelihood, your money. But on the flip side, when you are maintaining your health, when you are eating right, when you are exercising, when you're getting out there, you're moving your body, you're going to your doctor's appointments, you're going to your dental appointment, you're paying attention to the lab work, you are moving your body, you're eliminating stress out of your life. You got your meditation, your spirituality, all of that goes hand in hand. I'm telling you, when you are in line with your wellness, when you are taking it serious in terms of health and wellness, it will have a positive impact on your life in all areas. You'll be more productive. You'll be able to sleep better. You're going to save a whole lot of money because you ain't going to all these specialist doctor's appointments and you ain't on no truckload of medication. That's what eats up a lot of people's money. Because I don't care if you got good insurance. When you start going back and forth to these specialists, you are going to pay a copay. That insurance ain't paying everything. That insurance ain't going to pay everything. I know people who are in financial destruction because of medical debt. It's real, people. And I'm telling you, when you maintain your health, when you do all of those things to maintain and improve your health, you will reap the benefits, people. You will reap the rewards, or not just financially, but spiritually, mentally, medically. You are going to reap the rewards of maintaining and improving your health in all areas. And that's why I'm telling you, 4 days out of the week, no matter what, I'm going to work out. I'm going to work out a minimum of 4 days a week. I'm doing many things. I'm doing walking. I'm doing cardiovascular. I'm lifting light weights. I'm going to move my body for a minimum of 4 days a week as long as God gives me breath. And I'm reaping the benefits of that because I'm on no medication, people. None. My lab work is perfect in all areas. I maintain all of my doctor's appointments. So when I'm getting ready to travel abroad to go see this world, because I don't know if you're aware, when you go travel abroad with a guided tour, you ain't just sitting in your motel. No, that guided tour could be 20 people in that guided tour, and we are going and seeing all of these historical spots in this country. We are walking. We're carrying our backpack, incline, decline. We may have to get on a camel. We may have to be on a boat. We are moving. So if you got poor health, how are you going to be able to keep up with the guide? How are you going to be able to keep up with those people in that group? How are you going to be able to walk through the airport? I don't know if you've ever been to an international airport. It's huge. I think it was airport in London. I think London airport. That airport is so huge. When you get off the plane and got to go to the next terminal, I had to walk almost 2 miles to get to the next destination within the airport. So help me understand, if your health's so poor, how you're going to navigate through these international airports, people. This is real talk. Because you're in a foreign country. You got to know how to navigate. You're gonna have to be able to walk. And you ain't gonna be able to travel abroad in poor physical health. I'm telling you, it's not a good mix. So I'm telling you, when you are serious about improving your health, real talk, it will save you money. You will get the return on your investments in all areas of your life. I can attest to this. Every time I go to the doctor for my regular checkup and my regular lab work, they be amazed when you have to let them know what medication you on. For years, I've always put none, nothing. And them doctors and nurses be looking at me. You mean to say, you on no medication? No, I'm on no medication. Because my lab work is phenomenal. There's no need to be on medication. I take care. I'm on no medication. None. Only medication I take is a vitamin every day. So that means I'm paying attention to my lab work. None of that. And I know people in their 20s. I know people in their 30s on diabetes medication, or high cholesterol medication, or heart medication, or medication for everything from A to Z. This is real talk. Asthma medication. And the list goes on and on, people in their 20s. And I'm telling you, it's all about shifting your mindset. It's all about shifting your mindset and making behavior changes to improve your health. Real talk. I gave up sugar going on 2 years now, and don't miss it. I've gave up added sugar going on 2 years, and don't miss it in any shape, form, or fashion. I gave up junk food and everything, anything associated with junk food and added sugar. I gave up well over going on 2 years. And I'm telling you, my lab work has thanked me. Real talk. So share this information in terms of when you improve your health, it will save you money all the way around. So again, don't forget to mark your calendar for June the 24th. At 6:30 p.m. Eastern Standard Time for my next live stream lecture. I'm going to give insight on many of the things I do to continue to grow my YouTube channel. That's all I have. Simplify, simple fidelis, and I'm going to leave you in the care of your own conscience. Have a great day.